wellness revolution starts now.
Well, welcome to the program. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. And I am joined by the Kim Bennett, our pharmacist in charge at Physicians Preference Pharmacy. So I'm so excited to have a conversation with you today about your expertise and what you've been seeing in pharmacy all these years. We're going to be discussing some different dosage forms like pellet therapy versus what we offer. So our goal here today is to open up the conversation about what's available so that you're informed and you can make your own decisions for yourself, because at the end of the day, that's what we want to support you in doing. So this is pretty cool. We have a pharmacist conversation.
Yay! Happy to be here.
Yeah. So the reason that we wanted to talk about this is because it's a common question that we get from guests, from family members, from physicians that prescribe with our pharmacy is, do you offer pellet therapy? And in general, we're not huge proponents of pellet therapy. We're going to get into the pros and cons, though, again, so that this is a more or less unbiased conversation. But I want to start out by outlining some of the symptoms that people with hormone imbalance experience. Because when we're talking about pellet therapy, or if we're talking about oral or topical or vaginal dosage forms, we're talking about balancing hormones, right? So if you're experiencing fatigue, low energy, if you feel cold when everyone else is warm, if you're having temperature dysregulation, if you're having breakage in the hair or the nails, or if you feel like you're succumbing to sicknesses easier than some other people, maybe your family members, those might be some indications that you have some hormone imbalance. And it may look different in men and women, but I think that that's kind of a general explanation of what we see. Would you add anything to that?
Cognitive decline, brain fog, weight gain around the middle, loss of muscle mass, things like that.
Yeah, or just general drive.
Right.
Lack of desire for normal daily activities and to stay focused on any attention-related task. Right. We hear about that a lot too. So let's jump into pellet therapy. So I think it's kind of a buzzword, but let's just go back to basics and discuss what it is. So Kim, explain hormone pellet therapy to us.
So pellet therapy is basically hormones that are put in small cylinders, basically the size of a grain of rice. That's what most of them are, is size of a grain of rice. Typically, pellets have testosterone and estrogen. They do not have progesterone. So if you do pellet therapy, you have to do additional progesterone therapy, which is usually in the form of cream or oral capsules. So you typically have to take an additional progesterone. Pellet therapy is a minor surgical implantation. So, people have the little small incision that's usually in the hip. And so there may be some pain. There may be some surgical site pain. They may not be able to go to regular activities right after, maybe take a couple of days before they're able to get back to regular activities. But they are bioidentical hormones that are put in just these little small cylinders that go directly under the skin.
Okay. So we focus a lot, of course, at Physicians Preference on bioidentical hormones. And I don't think we need to go into full explanation of that, but can you brief us on that too?
So bioidentical hormones are hormones that are structure to structure, this identical to the hormones that your body produces. So that when you take them, your body recognizes them as its own. And what that means is when you ingest bioidentical hormones, the body says, oh, I recognize these. I know how to process these. They follow the proper pathways. You have less side effects, even hardly any side effects at all, actually. And your body knows exactly what to do with them.
We like that, lesser side effects.
Exactly.
For pharmacists, that's like music to our ears.
Exactly.
So what I'm hearing you say is that requires an in-office visit.
Of course.
Because the physician is the one that's implanting the pellet into the hip.
That's right.
Okay. So just like with anything, it's going to also run out, right?
Yes.
Eventually. So it's going to require multiple trips to the physician's office to keep getting that implanted. How often do they usually have to visit to have that done?
Every 3 to 5 months is what I've heard the most common averages.
Okay. So we like that there's BHRT in there. We like that it's bioidentical. We don't like the multiple office visits.
Right.
We don't like that it's surgical. And I definitely want to touch on dosing because this is one of our main
Yep.
All right, let's stop and have this conversation whenever we get asked by a guest. So let's talk about the difference in dosing from something that we might dispense at physician's preference, which we're going to talk about the dosage forms we have available in a little bit. But, we usually focus on topical, again, or vaginal or oral or sublingual or something like that. How does the dosage differ in something that's inside of a pellet versus what we offer?
So pellet therapy is typically what's called supraphysiologic dosing versus what we have is physiologic dosing. And what those two words mean, supraphysiologic is excessive dosing, way higher than what the body would normally make. Physiologic dosing is what the body would normally make. So like what our bodies make throughout the month where we just kind of do this, that's what we're trying to replenish in physiologic dosing. Supraphysiologic dosing is really high, which leads to a lot of side effects.
So physiologic is what our body wants.
That's exactly right.
It's kind of our homeostasis, our normal. It's how much our body would release on its own on a daily basis, right? Or be produced and then released out into the body to keep our hormones in balance. When you were talking, there was something I was thinking about is pharmaceutically speaking, so in pharmacy school, the way we're trained is about different dosage forms. If you take an oral capsule, you're taking into consideration, is the drug or the dosage form, aka a capsule, getting broken down in the stomach acid? If it's a sublingual tablet that goes under the tongue, we have to take the size of the molecule into account, for example. We could go through all the dosage forms. But if we're talking about a lot of the dosage forms that are super physiologic or intended to be driven into or through the skin, there has to be a method for that. So if it's a patch, there has to be something in it that is going to penetrate the drug through the skin so that over hours or days, it can continue to be effectively and consistently released into the skin. But with pellet therapy, it achieves that literally by supraphysiologic dosing.
Exactly.
So by putting a much higher dose in that pellet that's getting driven out into the bloodstream consistently. So what if the physician doesn't get the dose right?
So if they don't get, and we've heard this, we have heard actual patients tell us these things. If they don't get the dose right, honestly, there's nothing they can do about it. If the dose is too low, they have to basically wait for the next office visit and they get a higher dose implanted at the next visit. If the dose is too high, wow, they're really going to be hurting. We have heard of such cases as both men and women actually having anxiety to the point where they could not work. They had to take time off of work because they were having such extreme anxiety from the pellet therapy because the dose was too high. I've actually spoken to a female patient who was growing chest hair. And she said, you know what? I just shave it off. And not even thinking that maybe my dose of this is too high. And that's a man's dose. And what could happen over time inside the body that's an outward sign. But what's going on inside the body could be really scary later on. And that's not good.
That's a really good point. I was counseling a guest on the phone a few weeks ago who this was her first time taking our sublingual testosterone, which is one of our favorite dosage forms for a lot of compounds that we provide because it dissolves underneath the tongue very quickly and enters into the bloodstream very quickly. So it's a quick on effect. We like that. Low chance of side effects as well. And this was her first time. She was transitioning from pellet therapy over to sublingual. And she said, now, is this going to make me grow hair on my chest like the pellet did? And I thought,
common.
Oh my.
It's so common.
Okay, but that's a legitimate question. So let's talk about that. And I was really happy that I could say no. There will be no razors involved. It's just trying to balance your hormones. Yeah. So but these are real questions that we get, right? So you covered which hormones would go into pellets. So that would primarily exclude progesterone. Right. So they still have to supplement with some sort of an oral, likely an oral or topical dosage form in between. And if the dose is too low, they'll have to go up higher at the next dose. If the dose is too high, they can't really carve it out. No. It's in there, right? It's my understanding it kind of dissolves as a gel, right? And then dissolutes out into the body. Okay, so let's talk about some of the dosage forms that we have available at Physician's Preference Pharmacy that we are primarily using in our guests and why we like them. So we talk a lot about how the practice in the pharmacy was built a lot on formulating progesterone. Right. Progesterone makes us feel good. It's one of our hormones, not to be confused with just being a female hormone, because we not only give males progesterone, but males have to make progesterone on their own. So these sex hormones are actually shared by men and women. We all have estrogen. We all have testosterone. We all have pregnenolone. We all have progesterone. We all have these, just in different doses, which is why we want to keep the dose appropriate to the sex of the patient, male or female. So what is our favorite or most common dose for progesterone that we compound?
Capsules.
Okay. Capsules. And I think we do quite a bit of creams as well.
We do.
Some common questions that we get from guests as they switch from dosage form to dosage form is, well, is the one I'm prescribed now better than the last one? Or which one is superior? The answer is yes and no. It's completely patient dependent. It just depends on what you're trying to achieve.
Right.
So one of the probably one of the primary issues that we see is that guests have a weak gut. So we focus a lot on yeast overgrowth, candida overgrowth. We talk about toxin ingestion and how that basically rips up the gut, repeated antibiotic use, which rips up the gut. And so we oftentimes are pedaling backward to fix the gut before actually the gut or the guest can be really receptive to the hormone therapy that we're using. There are other hormones, such as the thyroid hormone, that require a good diverse microbiome or gut health to actually convert inactive thyroid to active thyroid. So it's a lot like vitamins, supplements, minerals, medications. It's all the same deal. If your body's not ready to receive it and convert it, you're basically just peeing it out and you're wasting your money.
Right.
So we want to be sure we get the dosage form correct as well. So if a guest does not have great gut health, we may choose a topical cream at that time.
That's right.
If they're flashing, if they have hot flashes, if they have sexual dysfunction, if they have vaginal atrophy, then let's put it there. Let's make it into a vaginal cream. So if we can customize the dosage form, the guest is always best off.
Exactly.
Right? So Kim, you've been here a really long time. And
Really long time.
a really long time you have. And so you've seen a lot of things go in and out of the pharmacy. Can you talk to us about our sublingual dosage form? Because that was probably started after you began here.
Yes.
Is that right?
Mm-hmm.
You talk to us about that one?
We probably brought that on about 12 or 15 years ago. And at the time, I don't believe many other compounding pharmacies were doing sublingual tablets. I think we were probably one of the first pharmacies to do a sublingual tablet. And I wish we'd have brought some samples to actually show them on camera because they're beautiful. They're like pharmaceutically perfect.
Mm-hmm.
The way we make them, obviously we have a tablet press to make them, but testosterone, like you said earlier, is one of our most popular, most common hormones that we put in the sublingual dosage form. And I mean, people love that dosage form because it's so convenient and it's so easy to use. Estrogens, they're kind of getting away from using oral capsules for estrogen because of the clotting issue that women could experience. And sublingual tablets are a different way to go because it dissolves under the tongue. It gets absorbed into the vasculature under the tongue. It does not get swallowed, and it does not go into the bloodstream so quickly like an oral capsule would. So the sublingual tablet is more of a delayed delivery, and that's what we like about it.
I love that. One of the other aspects that we really prefer about oral, sublingual, topical, vaginal dosage forms is that it's adjustable. So we talked about how when pellets are in, they're in.
Right.
When we talk about the other dosage forms, we have control to tweak it as needed. And why I think that's so important is we're talking about sex hormones. And you'll really resonate with this if you're a female because your hormones are like a roller coaster month to month. So trying to nail down how you're going to feel any one day is pretty difficult to know. So having the flexibility of dosing and maybe having that conversation with your provider where they say, hey, we're going to back down from every day dosing to Monday, Wednesday, Friday. And then we rectify the situation and you're not committed to the pellet that has already been implanted.
Or let's take 2 capsules or 2 sublingual tablets at night to take care of the hot flashes or night sweats, you know, and let's try that for a while and see how that works for you.
Well, that's true. And one of the tools that we use for dosing is amping up AM dosing versus PM dosing. So if you got a pellet in there, it's of course in there 24/7.
That's right.
And if you're having mood swings and hot flashes during the day, and then you want to tweak and bulk up your AM dosing so that you have coverage of those sex hormones throughout the day. If you're having hot flashes, poor sleep, anxiety at night, then maybe we want to bulk up your PM dose so that you have coverage throughout the night, you sleep well, and you're not hormonally imbalanced and sleeping poorly.
That's right.
Any other comments on pellet therapy or any of the dosage forms we offer?
I think we kind of covered everything.
I think we did too.
Yeah.
I think we did a good job.
Yeah.
We should do this more often.
Yeah, we should.
I do want to shift gears for a moment and discuss quality. Because at Physician's Preference Pharmacy, the way we do things is, of course, a little bit differently than other pharmacies that you may encounter out there. And we believe that's a very good thing. A lot of that is due to Kim and her oversight. And like I said, she's the pharmacist in charge, so she keeps us all in check. But most importantly, she makes sure that we are not just meeting the standards that we have to by the state boards of pharmacy. How many licenses do you have?
I have 18.
18 state licensures, which allows us to ship into those states. So that's really important in serving our guests around the country. And at the same time, we do a lot of on-site testing in addition to third-party verification of potency. So that goes beyond the stringent recommendations or laws that may be put in by these state boards. But I really want to let you talk about that. So let's discuss, tell us about some of the quality aspects that make Physician's Preference different, but why that's important. And I think let's tie it into why that's important with hormone therapy.
Okay, so hormone therapy is the bread and butter of what we do here, and it's what we've done since our inception. A long time ago, we were the first pharmacy that decided we wanted to start potency testing our hormones. So we were the pharmacy that paid to create the assays at the laboratories in order for potency testing to begin. Now, what that meant was the state boards of pharmacy would come into compounding pharmacies and they would take samples. They would send these to the laboratory to test. We were the pharmacy that paid for that assay for even the state board to send other pharmacy samples for. So we really were the forerunner in potency testing for compounding pharmacies way back when. I've been here since 2004, and we were already doing potency testing when I started here. So we've been doing potency testing before potency testing was cool.
It is so cool.
More people are doing it now, but I mean, they should have been already, really doing this. So we do weight testing on site of all of our batches. So we have these really large machines that sort our batches. This is where I get excited, nerding out on it, that sort all of our capsules with accept and reject according to how we set them. Our standards are more stringent than the United States Pharmacopoeia standards, which are plus or minus 10% for these weights. Our standards are plus or minus 3%. So if they fall outside of that 3% range, they go away. We're not gonna even send them for potency testing. We're not even gonna send them out for the guest to even have. So that's the first criteria. And then the potency testing obviously is the same, plus or minus 10%. Nothing outside of that goes out to the guest. We're not going to allow that to happen. We've been PCAB, which is Pharmacy Compounding Accreditation Board, accredited since 2007. Every 3 years, we go through an accreditation survey, and we've maintained our accreditation since 2007. We were one of the first pharmacies in the nation to do that. It's a voluntary process. You turn over your SOPs, they review them, they come in and spend a couple of days watching you to make sure that, yes, you are doing what you say you're doing. So they validate you and say, okay, you're accredited for non-sterile compounding, which we are and have been since 2007. We do hazardous compounding here. Hormones are now hazardous compounding, so we protect our workers with extra garb. We've got negative pressure in our rooms now. It's quite a beautiful sight to see down there in our labs, and it's a great place to be.
Everything front to back is barcoded as well.
It is.
Eliminate and reduce any chance for error, of course.
That's right.
There's a lot that happens in a pharmacy day to day, and so we need to stay diligent and as systematized, I guess, as we possibly can be to reduce any chance of errors. So when you're talking about the USP, the United States Pharmacopoeia, I think a lot of people are familiar with USP regulations, or they hear that. That's thrown around a lot, but as the way that actually relates to pharmacy, is it is a grade of quality and expectations. Right. And when we talk about hormone therapy, I'm specifically thinking about thyroid because we do so much thyroid here that we compound. That's a medication that we refer to as a narrow therapeutic drug. So whether you go to XYZ pharmacy down the street and you're purchasing commercially available levothyroxine tablets, or you're getting T3, T4, or desiccated thyroid from us at physician's preference, that's still considered a narrow therapeutic treatment. And so what that means is that a little tweak in the dose goes a long way in the body. And so if you don't hit the nail on the head, it really can cause a lot of symptoms because the dose is too high, or the patient is still highly symptomatic because the dose is so low.
Right.
So how does that tie into quality? If the team is not consistent in their processes and they're not doing it in the right order, think about baking a cake, but being 10 times more detailed about it, how you fold in each individual ingredient, things can go haywire really fast. So when pharmacies start talking about, we compound this, we compound that, that kind of is like nails on a chalkboard to us because this is our lifeblood. This is what we do. We put our hearts and our souls into it, and making sure that it's consistent for the guest month after month after month is crucial, because if you've ever been with a physician and you're the patient and you've experienced this, maybe you've been taking your medication just like you've been prescribed, and you go to the doctor and they're saying, why are your labs way up or why are your labs way down? A lot of times that can come as a result of the quality of the compound.
That's right.
Or the medication in general.
Yep.
So that's something that should always be addressed and questioned, which is why our doors are open to receive questions, to be very transparent with our guests and with our physicians, to let everyone know exactly what our processes are, because you should always be able to pick up the phone and call and ask these questions.
That's right.
That's super important. So any final comments on quality for us that you have, Kim?
I think you hit the nail on the head. The quality in your compound dictates how you're going to feel month after month. So for sure.
Absolutely. Well, this was fun.
It was
I
fun.
always like talking with a fellow pharmacist.
Yes, it was a blast.
Yes. So, of course, if you have questions about anything that we discussed today, about any of the symptoms of being hormone deficient or hormone imbalanced, remember that's a major reason why we get sick, is either because our bodies are out of balance or we're deficient in something. But the good news is we can easily correct that.
Right.
And of course, your compounding pharmacy is a crucial part of your healthcare team. So if you have questions about any of these compounds that we discussed, please, we encourage you to pick up the phone and give any pharmacist a call at Physician's Preference Pharmacy. Our phone number is 281-828-9088. And of course, you can always go to our website at physicianspreferencerx.com. And we look forward to speaking with you soon.
Thank you.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.